Yeah. Okay. Rahulbhai, you said I can go ahead now?
Yes, ma'am.
Okay. So good evening, friends. It was really a privilege to talk on behalf of Dr. ASHOK VAIDYA, who has really prepared this address and will be available later on if anybody wants to ask any question. And for this, my thanks also to provide me this opportunity goes to Dr. Lopaben Mehta and also to Professor Sunil Pandya. So as can be seen in the next slide, may I have the next slide, please? Yeah. This was a photograph of Professor UK Sheth at the age of 6 years, has been kindly given to us by Dr. Anil Sheth, and many thanks to him and to Dr. Bharucha, his wife. It's very interesting to see that his childhood was during the pre-independence era, and I would add to it also a British Raj era. And so he had, as a young child and later on in his youth, has kind of a imperialistic as well as freedom fight movement that was absolutely at its crucial point, and he was exposed to both. Here you can see one of his relatives' uncle, a freedom fighter and a journalist with a very incisive pen, like a sword, absolutely ardent Gandhian. And he and his daughter, Labubin Mehta, and her husband, Sopan, Mohanlal Bhai Mehta, they run Janmabhoomi. There's also a time when Swami Vivekananda was at the same place where Amritas was born and was his native place, and that is Limdi, a small town in Saurashtra. And Swami Vivekananda was really honored and was looked after by the none other than the Maharaja of Limdi. And there is a nice story which will not go into the details today, but as can be seen in the next slide. Next slide, please. With Kimchan Bhai Sheth, Professor UK Sheth's father, was an employee with Indian Railways, about which there is a lot that is written in the history about Indian Railways, as it was a pride and that of British Empire. With this, that Kimchan Bhai was employed, he had many transfers, very frequent transfers. And the school education, I wouldn't want to use the word suffered, but flourished in different parts of the Western pre-independent India, where I believe that he had also studied in Karachi during his school education. So Professor Sheth had multiple interests in music, poetry, paintings, movies, drama, museum, literature, travel, and photography. This multicultural and multi-ethnic exposure provided a kind of a canvas for him. And this slide that you see of Mona Lisa reminds Dr. ASHOK VAIDYA of the talk and address that Dr. ASHOK VAIDYA gave to the first year students entering GS Medical College, where he talked about creativity in medicine. And at that time, Professor UK Sheth had provided some of the slides when he addressed. Next slide, please. So Professor Sheth had really BSc in microbiology to start with. Then he joined GS Medical College for MBBS and later on for post-graduation MD in internal medicine. He was assistant professor from 1950 to 53 in Department of Pathology at Dr.M.V.L. Nair Medical College, Mumbai, where he also headed the Department of Pharmacology for a while. Till he shifted to a very popular department of pharmacology, which was founded by none other than Dr. S. Paranjpe, who has written about history of pharmacology and has been a very popular book. Also, at the similar period was Professor Roger Lewis, who was visiting on behalf of WHO. And so when he became head of the Department of Pharmacology, there was already a kind of an atmosphere that he loved. He was there as a head in 1956 to 73 in the Department of Pharmacology at GS Medical College, where he continues as director professor of the department till 1978. But can you think of his retirement? No, not at all. WHO, he was a WHO consultant in pharmacology for Nepal from 79 to 81. And for 8 years thereafter, he occupied the position of WHO consultant for malaria and filariasis. Next slide, please. So very interesting was his unusual triple academic competencies. He was, really speaking, a postgraduate in general medicine. Then he did microbiology, pathology. And so pharmacology, when you talk about the experimental pharmacology or you talk about clinical pharmacology, this triple academic competencies came very, very, I wouldn't want to say useful, but under this, the department flourished, and so also the colleagues as well as later on his students. Self-trained pharmacologists who inculcated this attitude in his students. Next slide, please. So advanced training in neuropharmacology was at the University of Utah, where Professor Goodman, and this book is so well known that the pharmacological basis of therapeutics were Goodman and Gilman. In that department, Professor Sheth and Dr. Borison pioneered a technique for studying central effects of drugs. Could be neurotransmitters, phytoactives, can be utilized later on for any of these things. What they studied was central pyrogenic action of Salmonella typhosa, LPS, injected into the lateral cerebral ventricle in cats. And they are injected at various places, and they found that article is excellent, and anybody who is interested in neuropharmacology could avail of this historical article. And this pioneering technique was also acknowledged by Feldberg Group, who have written a lot about the hypothalamus and thermogenesis. Professor Borison and Professor Sheth, as we recall, visited our home while we were at Yale University in mid-60s. Next slide, please. Eminent colleagues in the Department of Pharmacology that one would want to remember are Professor Satoskar, Professor Bide, and Dr. Ganatra. Professor Satoskar pioneered in nuclear medicine and radioisotope laboratory and a popular textbook of pharmacology and therapeutics. And this has been very popular not only in India, but also in other countries as a textbooks of pharmacology. Professor Bide, a polymath, exceptional, eccentric, and extraordinary, a pioneer in toxicology, and he developed pharmacology at All India Institute of Medical Sciences and guided eminent scientists. So is a story about Dr. Ganatra, who with Professor Lewis had worked on Hatazan in tropical eosinophilia, and a fantastic history of tropical eosinophilia. A new look is a historical aspects, and how they have connected with filariasis is also very well depicted in this journal of Postgraduate Journal of Medicine 1980, an article where Abba and Samuel has also contributed. Next slide, please. So development of clinical pharmacology in India, the very first unit, the foundational efforts for this discipline of clinical pharmacology has many contributors, and now is a history. This eventually led to the establishment of the Department of Clinical Pharmacology, very ably led by Professor Nilima Kshirsagar, Professor Thatte, and Professor Nitya Gupte. Harry Gould predicted that Mumbai will be one of the great centers of clinical pharmacology, which is true. And so you see here, Dr. Gupta, Karandikar, Professor Dr. Dilip Mehta, and Professor Harry Gould at Cornell University. And I think that Dr. Miss Gold had visited Mumbai. Next slide, please. So domains of research in experiment and clinical pharmacology. In the earlier years, a lot of work on clinical pharmacology of diuretics were done. An R37 compound, an analog marketed by Smith & Kind as triamcinolone globally. And first Indian clinical trials with furosemide and spironolactone was done here for dosage optimization, which became globally relevant. Phase 1, 2, and 3 studies with new chemical entities discovered in India, RRL Jammu, CDRI, or Sibagagi, they were done here in this unit of clinical pharmacology of GS Medical College under Professor Education. Exploratory studies with Indian medicinal plants for several indications and computerized database of patients with cirrhosis of liver was done at TIFR and University of Mumbai. He has more than 600 research papers in reputed journals, and it was a major, Professor Yukesh played a major role in founding the Indian Society of Pharmacology and its journal. Sir always said, Professor Yukesh always said, research prospers by collaboration. And this dictum she had applied not only for within the institute, but also the major collaboration was with the industry, government, like CSIR, ICMR, and others. The next slide, please. That was front page news headlines, and I still remember that. Yes, I do. And Dr. Vaidya and I, we were talking about it, and we remembered that. How Manu Bhai and Jyotiben, his wife, Dr. N.V.L.Kothari, and we lived very side by side in the quarters that were given to the fellows or the people who were employed at Hafkin Institute. And both ASHOK worked as a typhoid research officer and was N.V.L.Kothari also working there. So both the families of Manubai and our family, we lived side by side there only. And once Manubai started complaining about that he had many times common cold when he was at GSMC, and he was advised by Ashok to go on salt-free diet as per Ayurvedic traditions. And I would point out here, Lavanasya Ati Yogena Amlapittam. So it is the excessive use of salt for also peptic, gastric acid conditions. And what had happened was that Manubai not only was relieved of the frequent attacks of cold, but he also noticed a marked relief of heartburn and acid peptic symptoms. What had followed was an article that was in Lancet, Common Cold and Common Salt, was flashed, and the news were on the front page of headlines. Suddenly, the press descended on the Department of Pharmacology, and UKS had to give many interviews. So this was the article by Dr. Kothari, Dr. Jayan Doshi, Dr. H.G. Desai, Dr. Vaidya, Yukesh, and Dr. J.M. Mehta. Reduction of gastric acid secretion on a low salt diet and furosemide in gut, a high impact journal, 1969. This was published there. Very interesting that I would like to recall here, and Professor Dr. Ashok Vaidya had guided our Vaidya scientists working at Kasturba Society Medical Research Center, Vaidya Namrata Pathak Gandhi, who had presented this case of Dr. Manu Kothari, and as well as pointed out, currently what has been emerging is that NSCL pre-treatment attenuates H. pylori-induced DNA damage and exacerbates proliferation of gastric epithelial cells and other gastric diseases, including the ulcer and the cancer. So it was very interesting for us to recall what was observed with his salt-free diet and to reflect on something like that NSCL pre-treatment attenuates H. pylori-induced DNA damage and also causes exacerbation of proliferation of gastric epithelial cells and diseases, related diseases. Next slide, please. So there were awards, prizes, and recognition. Prestigious Bhatnagar Award bestowed by Professor M.G.K. Menon that you can see on this slide. Professor Menon giving the award to Sir Professor U.K. Sheth. Dr. B.C. Roy Award as a Best Medical Teacher, and Sri Amrit Modi Award for Excellence in Research. ASHOK VAIDYA organized Professor U.K. Sheth Prize for the Best Paper at IPS, and also U.K. Sheth Oration at JSMC and KM Hospital. So was also that I recall myself also how actively both of them were involved when they were creating the syllabus for diploma in clinical pharmacology, and also a blueprint for CDRI and anticipated CBA awards for clinical pharmacology at GS Medical College and KEM Hospital. Sorry for the spelling mistake, KEM Hospital. Next slide, please. There was a family of musicians. Here you see D.V. Palus's picture, brother-in-law of Professor U.K. Sheth. And this has been also Dr. Anil Sheth and Dr. Rucha Sheth's family with 3 sons and daughter-in-laws and all the grandchildren. Anil and Rucha have organized a Sangeet Sandhya on December 29th, 2022 at Juhu Ville Pale Club. Rucha and the family members will be singing, and one of their grandsons, I believe, is a tabla player. Next slide, please. Thank you very much for patient listening. And here I would like to also say my pranam to Professor U.K. Sheth. I did my, and Sushila Ben. Sushila Ben was always with a smile, as you can see right here also. And if I'm not mistaken, this was at their wedding anniversary, 75th, as I believe. And I have done my PhD under Professor U.K. Sheth, and was a great collaboration with Sunil Pandya, part of my thesis with Dr. Sunil Pandya and Ruby Jangir. And it was neuroendocrine active agents effect, study of the effect of neuroactive agents on the reproductive endocrine disorders. Many thanks. Thank you. Dr. Vaidya is also here if anybody wants to talk to him, any remarks or whatever.
Thank you so much.
And thanks, Rahul Bhai, for sharing my slides. Thank you very much.
So now our next speaker for today is, excuse me. Our next speaker for today is Dr. JAYA DESHPANDE ma'am, who will be talking about Dr. Suman Henry. Few words about Dr. DESHPANDE ma'am first. Dr. JAYA DESHPANDE ma'am was a visiting fellow in cardiac pathology at Columbia University. She later worked as a professor of pathology in St. G.S. Medical College and KM Hospital and trained in cardiovascular and thoracic pathology under Dr. Suman Henry ma'am. She retired as a professor and the head of the Department of Pathology at Topiwala National Medical College. She was also a consultant pathologist at the VAIDYA group of hospitals and at SRL laboratories. It's an honor to have ma'am with us today, talk about the life of Dr. Suman Henry ma'am. Thank you, ma'am.
Unmute. Yeah, madam, we have to unmute. Yeah.
Very good evening to all of you. And to begin with, I would like to thank the organizers of the History of Medicine lecture series under Dr.M.V.L.Kothari Chair and the Division of Medical Humanities. For me, it is a privilege and an honor to talk in this forum, particularly about my respected teacher, Dr. Suman Henry. Dr. Suman Henry was the professor and head of the Department of Pathology from 1978 to 1988. And it was during this period that I was working directly with her. And she was through and through um, started her career from St. G.S. Medical College and retired also from St. G.S. Medical College. She was a pioneer in cardiovascular and thoracic pathology, a specialty which was not very developed in those times, nor, I mean, even today it is not so very developed, but she took a lot of interest in developing this specialty. She was born in Pune and grew up in Pune. During her schooling and early college days, she was in Pune. She belonged to an illustrious family and grew up in the pre-independence era, and her family had a very they were truly illustrious and had a strong nationalistic feel. So this is a family photograph of her grandparents, her parents, and Suman Kinnari with her brothers. This is a later photograph with her parents. Her father was a dentist and with her two brothers, and a subsequent still later photograph with her parents and her two brothers with her family. Dr. Suman Kinnari never got married. She was totally dedicated to the subject. She did her schooling and early college in Pune, and needless to say, she had a brilliant academic career. These are some of her childhood photographs. Her academic career just was on the rise forever. She studied in the Renuka Swarup Girls High School, topping all the examinations. And she was awarded the Best Pass Student Award from the school, and given this award by none other than the President of India, late Shri Rajendra Prasad. After her early college days, she shifted to Mumbai to pursue her interest in medicine and joined GS Medical College as a medical student. Here also she did exceptionally well and chose pathology for her post-graduation. Here also she cleared the examination in the first attempt. Very unusual feat in those days, since not many would really clear the examination in the first attempt. She then joined the Department of Pathology as an associate staff member. She got a Rockefeller Fellowship for training in cardiovascular and pulmonary pathology. This took her to the University of Illinois at Chicago and to the Yale universities. She worked under masters like Dr. Morris Leff, who was very well known, though he was a cardiologist, he was very well known for his knowledge and understanding of congenital heart diseases, and he had a huge collection of specimens, and there were numerous fellows who were undergoing training under him. She also worked under Avril Lebo. He was at Yale University, and he was a master in pulmonary pathology. And therefore, she got her training from both these experts. It was during her training under Dr. Morris Leff that she met Dr. Richard Van Praag and Stella Van Praag, who were also fellows at that time. They all remained lifelong friends, and Dr. Richard Van Praag used to remember her very, very affectionately. All of them had nothing but exceptional words for Dr. Suman Kinnari. They were totally impressed by her dedication, by her in-depth knowledge, and the way she would analyze all the material. She was in fact offered a staff position in US, but being a true nationalist, she refused the offer and returned to her alma mater, that is SGS Medical College. Here she was mentored by late Dr. P.K. Sen, the cardiac surgeon. They had set up a separate section for cardiology and pulmonary chest medicine, and also a separate pathology section to look after the patients and the research in cardiology as well as in pulmonary diseases. So Dr. Suman Henry was put in charge of the cardiovascular pathology section. In this endeavor, she was supported by Dr. K.G. Nair, who was a cardiologist, and Dr. S.R. Kamath, a pulmonary physician. So this is how the histopathology section or morbid anatomy section of the cardiovascular pathology looked like. A busy place with a lot of autopsy specimens coming in, surgical material of operated cases, valves, lung biopsies, pneumonectomies, and what have you. There was also a chemical and clinical pathology laboratory catering to the needs of cardiology and pulmonary chest the patients. And she also set up an immunology laboratory because she was quite forward thinking and knew that immunology was the upcoming area on which work had to be concentrated. Dr. Suman Henry was a great proponent of autopsy. She herself performed and supervised thousands of autopsies, and she had a wonderful clinico-pathological correlation. She collected a large number of specimens right from 1957 onwards. You could find specimens of various cardiac and lung diseases in that section. Each of them was beautifully described, catalogued, and meticulous records were kept. So this was the format she had prepared for each and every autopsy case of cardiac lesions or pulmonary lesions. A detailed clinical history, the laboratory investigations, and also the course of the patient in the ward and subsequent autopsy findings and the detailed description of the heart and the lungs. All these were bound together in every year and kept as volumes in the section. So you could always go back to these records and look for particular cases. Those were not the days of computer, but she developed her own indexing proforma, which could easily be computerized if and when the need arose. She had an in-depth knowledge of congenital heart diseases, so much so, remember, those were the days when there were no major investigative tools like echocardiography, color Doppler, MRI, or CT. All that the clinicians had were plain X-rays, ECG, and some pressure studies. So she was often called in the operation theatre for opinion when the surgeons were faced with a situation which they were not very sure what they were looking at and what they needed to do. So on more than one occasion, she used to be called to the operation theatre to help them decide what was the lesion and what was the surgical operation that was best suited for that lesion. She always looked up to Dr. P.K. Sen as her mentor, and she always mentioned he was her best critic. Between the pair of them, they described what was then known as Kinnari syndrome, later on known as non-specific aortoarteritis. This was a peculiar disease of the aorta that was often seen in those days at autopsy, and many patients also came with symptoms suggestive of aortic disease. Nowadays, it is recognized to be the same as Takayasu's arteritis. So they published a monogram, non-specific aortoarteritis, in 1972, and in 1998, she again wrote up the pathology along with the radiological correlation and brought out a newer monogram. I was associated with this particular book. She was very much interested in studying the different systems within the heart, particularly conduction system. Now, tuberculosis was rampant in our country, and therefore she took a lot of interest in cardiovascular tuberculosis, particularly understanding the conduction system in cardiac tuberculosis. Those were the days when Mumbai had numerous mills, and many of the workers there would develop chronic obstructive pulmonary disease. And Dr. R.S. Kamath would be, Dr. S.R. Kamath would be very interested in studying those patients. And Dr. Suman Henry developed a method of looking at whole lung sections. These are known as GOK preparations, very time consuming, but in the absence of MRI or CT, this was the best option available for understanding the different types of emphysema. She studied the mitral valve in rheumatic and non-rheumatic patients along with Dr. V.A.L.Kothari, who was the head of cardiology department. At this time, the incidence of coronary artery disease definitely showed a rise, and therefore, along with Dr. Pascal, who was in charge of the chemical pathology laboratory, they studied the pattern of apolipoproteins. The immunology laboratory was managed by Dr. Sita Nair, Padma Shastri, and Dr. Ishwari. So this is just to give you an idea of the whole lung section. This is a paper-thin slice of the lung, which is cut whole after fixation and mounted on a filter paper, and it beautifully shows you the emphysematic within the lung and their distribution. This was in 1976. She loved teaching. She had a passion for teaching, and her classes were extremely popular. The cardiology students, postgraduate cardiology students, cardiac surgery students, all would come down. Generally, classes were held on Monday at around after 4 o'clock, and there was no time limit. It would just go on and on. They would prepare the material on a particular cardiac anomaly, discuss the history, the pathology, the clinical findings, the surgical aspects, etc. And she would then demonstrate a bunch of specimens of showing the similar anomaly. And because she had collected specimens from 1957, there used to be lots of specimens of any given anomaly. And it was my duty at that time to come on Monday morning to pull out the specimens from the respective jars. They used to be literally pickled in formalin, put them in running water the whole day, and keep them ready for display at the 4 o'clock class. Apart from because of these classes, Innumerable students benefited from this exercise of looking at the specimens. In fact, I myself learned a lot of cardiac pathology, particularly congenital heart diseases, by attending these classes. She wanted to establish cardiovascular pathology as a separate subspecialty in pathology. So she held a first workshop on cardiovascular pathology in 1985. And subsequent workshops which I held and my colleagues held were all possible because of the treasure of material that was available to us. And there was a lot of demand for these specimens. The section was recognized by the Indian College of Pathologists to run a postdoctoral course. She was the first woman president of the Indian Association of Pathologists and Microbiologists, and her presidential oration was on her favorite topic, cardiovascular tuberculosis. She used to regularly attend all the conferences, pathology as well as cardiology, and here she is being felicitated on her retirement by Dr. G.V. Parulkar, who was the dean at that time. She was the head of pathology department between 1978 to 1988 when she retired. She was a strict disciplinarian yet compassionate. Apart from cardiovascular pathology, she also saw to it that other specialties in pathology developed, like renal, pediatric, cytopathology, gastrointestinal pathology. She would allot these subjects to different associate professors so that they could concentrate on the material in this particular area and develop an expertise. And this was the uniqueness of the Department of Pathology at GS Medical College. Along with Dr. Vijay Lakshmi Ray, she established the National Plasma Fractionation Center, one of its kinds in the country. This is at the inaugural function of the National Plasma Fractionation Center, along with Dr. Ray. And this is Dr. Banker, a very senior pathologist, practicing pathologist who was very deeply interested in transfusion medicine. This is a departmental photograph taken in 1988, just before she retired, with all the staff members and the postgraduates at that time. In 1998, I organized a CME in cardiovascular pathology. She had retired, but I had requested her to come and inaugurate the conference, which she very graciously did. And she was quite happy to see that the departmental work was going on and progressing well. By nature, she was very simple and unassuming, just a gentle smile on her face. I've never seen her laughing heartily or in a loud-hearted manner. But she was warm-hearted and helpful. We were all quite scared of her, but when we approached her for any kind of problems, she was extremely helpful and sorted out the issues. She was interested in literature. She played the music and loved traveling. She had an amazing grasp of national and international affairs. There used to be a Shakespeare club in GS Medical College in the anatomy department, and she used to attend these Shakespeare club. You can see Dr. Lopa Mehta and Dr. Manu Kothari. Invariably, they would invite outside professor of English or someone who was well versed with Shakespearean works to discuss any particular topic in Shakespeare's literature. And she loved these sessions. She loved traveling, went on many trips abroad. Dr. Shrikande, who was the professor of pathology at Tata Memorial Hospital, was her frequent travel companion. She was very attached to her family. She would go to Pune every vacation and spend time with her brothers and family. And any family function, she would never miss it. I worked with her for almost 20 years, and she was the most wonderful teacher that I ever had. I did learn a lot of cardiac pathology from her, as well as other things about how to manage life and so on. And what I understood is that when you teach what you love and share what you know, you open eyes, minds, hearts, and souls to unexplored worlds. And that was Suman Henry. She was an ocean of knowledge and affection, a perfect guru. We met her at her residence in Pune on November 2000 when it was her 70th birthday. She was terminally ill, and but she was happy to meet us. But unfortunately, we lost her within 6 months. So this is my humble tribute to a very great teacher. Thank you for your patient hearing, and my sincere thanks to Dr. Lopa Mehta and young Rahul for inviting me for making this presentation. Thank you all and a very good evening.
Thank you so much, ma'am. It was a splendid lecture. Now, our last eminent teacher for the day is Dr. PC Barucha. Speaking on life of Dr. PC Barucha is Dr. Nadir Bharucha. Dr. Bharucha was the former professor and head of the Department of Neurology at the Bombay Hospital Institute of Medical Sciences and is currently the chief of the Department of Neuroepidemiology there. He is the honorary neurophysician to His Excellency, the Honorable Governor of Maharashtra. Dr. Nadir Bharucha has published over 100 peer-reviewed research articles and textbook chapters, and his works have been cited over 2,500 times. Among his many awards and achievements, he has won the Wokhart Medal Excellence Award from Harvard Medical International and is the recipient of several prestigious orations as well. Unfortunately, Dr. Bharucha was unable to join us in person and has sent us a recording of his talk, which I shall play currently.
And thank you very much. I'd like to thank Dr. Lopa Mehta for inviting me to give a lecture on Dr. PC Barucha at in the History of Medicine series organized by the Department of Humanities at the KEM Hospital. The next slide. Dr. Firoz Kuvaji Bharucha was a well-known physician of his time. He was born in Mau, which was a small cantonment town about 20 miles from Indore in 1880. Mau was originally in the possession of the Holkars, but in 1818, following a fierce battle between the Holkars and the British East India Company, the British took it over and established a cantonment there. Prior to that time, just as a matter of interest, it was known as Mau, M-O-W, but they changed it subsequently later to Mau, adding an H, which was sort of an acronym for Military Headquarters of War. After independence, Mao went back to the rule of the Holkars just to complete the story. And shortly after that, when all the princely states merged and became part of India, Mao was again incorporated, but was redeclared a cantonment and still remains an important center for the army. In terms of, on a personal note, Mao was home to a number of Parsi families, and its Agyari or fire temple was one of the first to be built outside Gujarat. This is a picture of the EPB's, PC Barucha's family home. I'm not sure whether he was born in this home or whether the family acquired it after his birth. The family is shown here with PC Barucha on the our right hand side. His wife Bacha is to his right, and on the extreme left is his father Kuaji Bharucha, who was a school principal. Standing at the back are the other two brothers, Eddie and Dara, and a sister Alu. Dara remained a bachelor and remained in Mao and in Indore and became a lawyer and was a prominent member of the Indore Bar Association. Eddie became an engineer and was responsible for setting up the powerhouse in Mao, giving it electricity for the first time in 1928. And as a matter of interest, he subsequently did the same thing in Mount Abu. I'm not sure where Firoz Bharucha got his early education, but I do have a copy of a permission letter granting him permission. This is dated 1904, granting him permission to leave India to go to England for further studies. And the usual sort of civil service detail. He's got his age there, 22. The fact that he's a Parsi Indian, social and pecuniary status, house proprietor in Mao, and a leading resident of the cantonment. Date of probable departure 1904. And object of his visit to England was further medical study and to compete for the Indian medical service. Now, when he went to the United Kingdom, he worked at the, he studied at the University College London, UCL, and the University College Hospital. He did his MBBS and his MD, returned to India sometime perhaps in 1910, 1911. I'm not sure when he returned, but when he finished his studies, he returned. And in he must have joined the JJ Hospital and Grant Medical College sometime between 1910 and 1912. But the next bit of paperwork that I have is a copy of a letter which he and 5 other physicians and surgeons had written to the Secretary of State for India to allow them to become professors. Now, just a bit of background, the JJ Hospital was the first such medical establishment in India. And it had both British doctors and Indian doctors. Now, the Indian doctors were also very, very well qualified, including with degrees in medicine and surgery from Great Britain, but they were not permitted to become senior physicians or professors because they had not joined the Indian medical service. Now, PC Barucha set out to go to the Indian medical service, but for whatever reason, it must have been a long and arduous course which he felt would be a waste of time. So he came back, and none of our Indian consultants had actually applied, and perhaps there was some bias as well. I'm not sure. But they wrote a letter, very, very polite letter, respectful letter to the Secretary of State, saying that your petitioners hold degrees in medicine and surgery of the universities of Great Britain and are practicing as consultants in Bombay, that hitherto all posts of professors at the Kant Medical College, Bombay, the only institution of its kind in the presidency, have been invariably held by physicians of the Indian Medical Service. That it was therefore with feelings of gratification that your petitioners learnt that 2 new posts were to be created at the said college, appointment to which will be made from amongst the independent medical professions. However, to cut a long story short, in spite of all these sympathetic utterances, the petition was denied. And newly created posts of anatomy and pathology were conferred upon members of the IMS, creating great dissatisfaction amongst members of the independent medical profession. Ultimately, in 1916, Dr. PC Barucha resigned and went full-time into private practice. He worked extremely long hours, I should say, and I'll sorry, can you pause it? Okay. Now I want to go to the Light of Asia restaurant here. Is it there? Yes, yeah. He resigned. He married Bacha Dinshaw, a young lady from youngest of a large family from Karachi, the Dinshaw family, and sadly, when Dr. E.P. and their first son, Dr. E.P. Barucha, was born in December 1916. But sadly, Bacha died 2 years after giving birth to another child. And this really cut up Dr. PC Barucha tremendously. He was very, very upset, very disturbed by this, and to try to come to terms with this loss. Indeed, there's a story that he actually went to Vienna, Austria, and where either he had some contact with Freud or with the psychoanalyst there, but he came back with a whole lot of psychoanalytic books. This was told to me by my brother. And so he must have been quite disturbed and tried whatever he could at that time to help himself. But I think the main way he helped himself was by going full speed into his practice and looking after patients and helping patients. You would see patients in this building, which is on Dalabad Auraji Road, at that time called Hornby Road. He had a consulting room which he had rented on the second floor, and it was a large, spacious place, and where he looked after patients till probably about 11 or 12 o'clock at night. He would be out early in the morning and do his rounds. He would do home visits and looked after patients meticulously. And the next thing that happened was that in 1925, the KEM hospital started. And that was in part to the continuous efforts of a whole lot of prominent Indian doctors, including PC Barucha, and both the Golden Dust, Sundardas Medical College and the King Edward Memorial Hospital were established. and that facilitated academic advancement of Indian doctors as a matter of policy. PCB was one of the 5 honorary physicians appointed. The other honorary physicians were Dr. Jivraj Mehta, Dr. M.D.D. Gilder, Dr. A.S. Erulka, and Dr. P.T. Patel. I'm just mentioning this at this point that as he practiced and as he earned, he also gave. And he gave large amounts of money to charity, including to establish a nurses' home at the KEM and also to the KEM library. He was very fond of books, and he himself had a library of books in his home with journals and periodicals. So books were very important to him, and learning was very important to him. Under Dr. Jivraj Mehta, the KEM flourished, and there was a great bond of striving towards a common aim, ensuring a brilliant success for these institutions, as Dr. Sunil Pandya notes in one of his articles. These were the first medical institutions in the country staffed by Indians at the professorial and other levels, and there's a great sense of pride in all concerned. Just as a matter of interest, I have added the costs depicted here in this old article. The medical college was, the cost of the medical college was 19 lakhs. The cost for establishing the hospital itself was nearly 60 lakhs, and the hostels together were male and female were 4 lakhs. In addition to that, if you look at the average cost per inpatient per day, obviously things were much cheaper then. They were extremely low. But it just shows that on an annual budget of 3,41,000, one could do the enormous amount of work which hospitals like the KEM did. PC Barucha, in his private and public life, was a staunch supporter of the independence movement, always dressed in hand-spun suits. I don't know whether this is a suit which has been done specifically for the photographer, but otherwise they were hand-spun. And in 1938, he was appointed Sheriff of Bombay after being declared best suited for the office by the authorities at the time. In private, he is a rather stern father who is determined that his son should be disciplined and hardworking. He sadly died in 1952. In fact, he collapsed while seeing a patient, and then the patient's family then put him into an ambulance and brought him presumably to a hospital, and then brought him home, and he sadly passed away at home. Now, that's PC Barucha, but it struck me as I was writing this lecture that, what is it that made physicians in those days so popular and so renowned? We mustn't forget that they had very little in the way of diagnostic tools, very little in the way of therapeutic pharmacopoeia, very, very limited indeed. And the tools are basically the instruments, the bedside instruments that we should be relying on now, and sitting at the bedside actually and taking a history and doing a thorough physical examination and listening to the patient. And I think this is something which is important, and this comes to the older one gets, that medicine is learned by the bedside. It's something that we are taught in medical school, and we do very thorough histories, very thorough physical exams, and we listen to the chest, and you peer into the eyes, you look into the mouth, you look at the conjunctiva, the fingers, the chest, the tummy. But when it comes to later on, practice later on, most of these things that we've been taught early on are forgotten, and as a result, the practice of bedside medicine, I feel, itself has sort of become taken a back seat. PCB, as I said, was very popular. Besides the fact that he was hardworking and practiced bedside medicine, he spoke clearly. He gave good talks, good lectures in the KEM, in his ward. At the bottom of the ward, they'd have a bed and there'd be benches around it, and he'd give a clinic there. And I think one thing that we can take away from doctors such as Dr. PC Barucha, is that there are two things: is knowing the disease and knowing your patient. And knowing your patient is as important, if not more, than knowing the disease. And this approach in and of itself gives a lot of comfort to the patient. And in fact, one looks at is that on the one hand, you relieve the disease or you treat the disease, and the other hand, you look at the discomfort or the dis-ease of the patient and give him comfort. Thank you very much.
Subsequent to recording this talk on Zoom, and my apologies for the glitches that might have occurred. Dr. Shubha Pandya, who has taken a keen interest in the history of the medical schools in Bombay, the JJ Hospital and the KM Hospital, sent me some interesting information on the Borsad Committee report. Between the years of 1932 and 1935, there was an exponential increase in the number of villages and number of deaths from plague in the villages in Borsad Taluka, which was in the erstwhile Baroda state. The government of India did not take the steps it should have taken. This was the British government, and hence the Congress workers stepped in to help plague victims. The government objected and said that the Congress workers were interfering in their task, and so Sardar Vallabhbhai Patel, who was trying to help the plague victims, told the government, let's form an independent commission and look into this matter. But the government of Bombay decided that they would not accept Vallabhbhai Patel's suggestion, and so he said, okay, then let's have an independent committee to look into the matter, and you can join the committee as well. And then again they declined. So then there were several meetings, and the commission was formed, and two of the members of the commission were Dr. M.D.D. Gilder and Dr. PC Barucha, who visited several parts of the affected area and examined already 6 witnesses. Now, these 6 witnesses are witnesses to the incidents which the British alleged had occurred because of Congress interference. The conclusion they reached was that during the inter-epidemic periods 1932 to 34, the authorities failed to adopt even the measures that they themselves had recommended. Indeed, there was an increase in the number of rats, in the increased number of fleas, and then when the plague epidemics actually started, very limited disinfection of the houses and hardly any inoculation at all. Indeed, the syringes that were sent for inoculation didn't work, the needles did not work. So even the inoculation sets that were sent to the local authorities were not functional. And the committee came to the conclusion there was no indication as to the extent to which evacuation was carried out, and there was just some pretense at rat destruction. Now, it's quite interesting that somebody who is a prominent clinical physician, we talk of bedside medicine, etc., KM hospital teacher, makes the time and takes the effort to go out into rural area and to do this kind of what I would consider extremely good epidemiologic work. The next thing they found was that no clinical treatment whatsoever for any plague patients was undertaken in the taluka in this year. So as regards the specific charges dealt with by us, we find that the charges made by the government against the Congress workers were wholly unfounded. These are just the highlights I'm mentioning. And with regard to the charges made by Sardar Vallabhbhai Patel against the British, we find that the evidence tendered before us clearly establishes that. In accordance with the request, this note from Drs. Ginda and Bharucha is appended here too. Thank you very much.
Thank you very much, sir. So we have a few comments here, which I think we'll just read out and discuss. And then if you have any other doubts, please, or questions, please put them in the chat box. They may be discussed. We have a comment here from Dr. Malini Nadkarni, ma'am, who says that she was fortunate to have learned pharmacology from Dr. UK Sheth and Dr. Satoskar. Ma'am has also written about Dr. Kinnari, ma'am, saying that it was wonderful to learn about her. And she was a highly intelligent, motivated, and scholarly person, and she has been fortunate to be associated with her. And ma'am has given her respects to her memories. Dr. Pradeep Vaidishwar sir has said that madam had an amazing foresight, and she started subspecialties in pathology way back in 1980. Nadkarni ma'am also says she is very happy to listen to Dr. Jaya Deshpande ma'am after such a long interval. Ma'am also goes on to say that it was the great vision of Dr. P.K. Sen to hold branches like pathology, radiology, and anesthesiology equally important as his own, which made all these departments to grow well. She said it was an excellent talk. And Dr. Yash Lokhandwala sir wishes to comment about Dr. Kinnari. So please go ahead, sir.
Thank you, Rahul. Am I audible?
Yes, sir.
So, I was fortunate enough, and Dr. Jaya Deshpande also the faculty when I did my DM in cardiology in KM. The collection of pathology specimens at KM Hospital was unparalleled anywhere in the world, and it was available for us for free. Dr. Kinnari's classes were outstanding, but we could go anytime, pick up an atlas from the library, take out the drums. You had tetralogy of Fallow, hundreds of hearts of all types of congenital and acquired heart disease. If you went to a conference in Europe or in the US, you had to pay through your nose to even look at these specimens. And here you could handle them, you could turn them in all the possible fluoroscopic projections. It was a amazing, and I continue even today and Dr. Jaya Deshpande has carried on that tradition of teaching with these specimens. It's like ghar ki murgi dal barabar. What we had, we didn't realize. I didn't realize till later the value and the efforts and the pains that must have gone behind collecting this sort of thing for the use of all and for free. So hats off to people like Dr. Kinnari, and today we see so much commercialization of information, and those were the golden days when everything is, and I'm sure it's Dr. Jaya Deshpande, now Pradeep Vaidishwar. When I even today have a difficult diagnosis, I rely on nobody else but the cardiac pathology department of KEM. So, hats off to them. Thank you.
Thank you so much, sir. It was generally an amazing experience learning about all these great and eminent personalities. It's inspiring as a medical student to learn about their lives and careers. Now, Lakshmi ma'am says that she wished Dr. Nadir had spoken on his parents, Dr. EP and P Barucha, neurologists and pediatricians of KEMH. Ma'am, I'm sure we can have a follow-up lecture maybe in the next round of lectures in the History of Medicine lecture series to cover this topic. I would also like to listen to this. Now, finally, to conclude our lecture series, we have a vote of thanks. This vote of thanks will be presented by Padmaja ma'am. I'll just go ahead and share that. Thank you.
Am I audible, Rahul?
Yes, ma'am.
Yeah. Good evening, everybody. And I'm so proud today. Rahul's hard work with this whole series has really paid off, and the series is now sort of concluding. We might have another series which may come up soon. On behalf of Gosumec Alumni Association and on my personal behalf, I thank all the teachers in deep gratitude of all the speakers who have given us the valuable insights into history of medicine. So I would like to name each of them. Next. So first of all, nothing happens without administrative support and guidance of the administrators of the hospital, and I'm deeply grateful to our Dean, Dr. Sangeeta Rawat, for promoting our efforts and guiding us. Next. Dr. Pandya sir has been the rock, you can say. This greatest support. Dr. Pandya and Dr. Lopameta madam have been constantly at the sort of back of scenes most of the times, but of course in this series Dr. Pandya has given a lecture, but without their guidance I'm not sure we would really be able to take anything further in medical humanities. Next. Lopameta madam is continuously giving us new ideas, and soon we will be declaring what further treasures are coming your way. Thank you, madam, very much. I thank Dr. Jahangir Sorabji for giving the lecture on history of medicine, why bother. Of course, all of us have learned what sort of doctor to be. When we look at the history, we come to know what great stalwarts we stand on the shoulders of, and we must make use of appropriate opportunities that come our way. Next. Thank you, Dr. Mario Vaz, for talking on medical pioneers and their stories. Next. Dr. Bharat Kedkar for hurting war and healing medicine. Doctors Without Frontiers was one of his lectures way back, which we had heard in KEM itself, and that was offline, of course. And thank you, sir. Next. Thank you, Madam Dr. Mridula Ramanna, for talking on coping with epidemics, Indian doctors in colonial Mumbai. Thank you. Pandya sir, of course, the genesis of our institutions and some of our eminent teachers. Thank you, sir. Dr. Supe sir, who has been guiding light for us as a dean and medical director when we were in the infancy of our division on talking of story of surgery. Thank you very much, sir. Dr. Ravi Ramakantan. I don't think this division of medical humanities would have been there had he not really inspired us way back. I think just before 2008, I think it was 2006, 7 something, don't even remember. But thank you very much, sir. The life and times of Sir William Osler and sir, your lectures tell us as teachers what we ought to be. Thank you for reminding us that. Next. Dr. Bhavin Jankaria for the history of history taking, clinical medicine through the ages. Thank you, sir. Next. Dr. ASHOK VAIDYA. He delivered a lecture on some of our eminent teachers, part 2. Thank you very much, sir. Dr. JAYA DESHPANDE, madam, for some of our eminent teachers, part 2. Thank you, ma'am. And Dr. NADIR Bharucha, some of our eminent teachers, part 2. Thank you, sir. I would also like to take this opportunity to thank all those who have supported the Medical Humanities Division, Dr. Swarupa Bhagwat, who is my colleague from Transfusion Medicine, our support staff, Pranali Satpurkar, Deepika and Sadhna, Mr. Suhas Maitre and Mr. Tushar Kotwal, who have been giving us support from the technical point of view, Dr. Rucha Rakne, Rohan Verse, Radhika Thakur, Sharvari Petkar, Firdos Fitter and Rashmi Benge. These are all the students who have supported and actually toiled behind the scenes to get these series ready. Next. And audience, of course, but here I think in that the most important part of my thanks should go to Rahul. Thank you, Rahul, very much for organizing this. Thanks a lot. And thank you all, audience. I would also like to take this opportunity to announce our next course, which is on the narrative medicine and reflective writing, which will be starting from the first week of December. So thank you all very much and good night.
Thank you very much, ma'am. And thank you very much, everybody in the audience, for attending our lecture series and making it so special. We hope to see you in some more of our offerings. Good night.